Good evening, everybody, and welcome to this another web-based session. This is essentially, as we said, this is from Apollo Gleneagles Hospitals, Kolkata, and courtesy this current scenario, we have taken recourse to this web-based teaching, and because our students said that there are other people who are also interested in joining and kind of interacting with us and helping us also learn, we thought that we will use another portal, and this is the portal of HCP, which is Healthcare Professionals. And this is the first time that I am trying to do this on their portal, and let's see how we go about it. So first and foremost, about the developing brain and anesthesia, there is this person who also has the developing brain. And with that, I declare my conflict of interest, which is obvious, though we like the good things in life, and despite the COVID era or not, but I don't have any conflict of interest on this particular presentation. See, the conflict with anesthesia, neonates, infants, the developing brain, the first conflict is that it is very well known that the use of a balanced anesthetic technique is beneficial in decreasing the neuroendocrine and the metabolic stress response to surgery and altering the pain processing. Where it was Anand who discussed about not only the neonate, but also during fetal surgery that you have to take care of pain. You had Fitzgerald who thought about this cutaneous hypersensitivity following peripheral tissue damage, and he was talking about including vaccination and how it altered their sense later on. And then we had people like Taddeo who said that, if there was neonatal circumcision and if it was done without taking care of the pain, it had a significant effect later on in life and when they saw a painful procedure like vaccination. So it is essential that you take care of pain in neonates. And if you look at it from the physiological point of view, the nociceptive nervous system is mostly mature by 23 to 25 weeks post-conceptual age in humans. The nociceptive nervous system is, but the anti-nociceptive system develops much later in infancy, which means that premature and term infants are more sensitive to pain than adults. And why is this pain, especially if you don't take care of it when they're having pain, bad for the developing brain? Is because a chronic painful stimuli can provoke cell death in many areas of the brain, whether it is in the cortex, the thalamus, hypothalamus, amygdala, hippocampus. So it can cause cell death. So it's not a good thing to have. And of course, if you decide to withhold anesthesia during a painful procedure, it leads to poorer surgical outcomes and long-term effects are seen later in childhood. And there were allusions to this in the first slide that I showed about neurodevelopmental issues, behavioral issues, and cognitive defects. So the conflict is that you should be taking care of pain, you should be taking care of consciousness when an infant or a neonate undergoes a surgical or a painful procedure. The second part of it is, this is when you throw a cat amongst the pigeons, is there has been this data which has been amassing in literature regarding the potential adverse effects of anesthesia exposure on the developing human brain. Oppenheim, and this again is, these are elegant ones, not necessarily on human beings, but saying that it can cause cell death during development of the nervous system. The blockade of NMDA receptors can lead to apoptotic neurodegeneration in the developing brain. But what actually made people look into this kind of studies was very, very elegant studies which came out from Columbia. I think it's Columbia, Dr. Vesna, and don't ask me to pronounce the next part of her name, whether early exposure to common anesthetic agents cause widespread neurodegeneration in the developing rat brain. Is there another microphone which is on? Jayati, can you please take care of that? So
yes, sir, done.
Yeah, which brings us to the Act 3, Scene 1, the Hamletian question, or you can say the Heiderian question, to give or not to give, which is, will you give anesthetics to a surgical procedure? Will you withhold anesthetics during a surgical procedure? And will you give something which has got this potential or the neurotoxicity that comes inherently packaged with this drug? So that is this dilemma, to give or not to give. Let us look into the developing brain to understand this, okay? So immediately after birth, the brain is about 25% the adult size and is unevenly matured. The brainstem and the spinal cord are relatively well developed, whereas the limbic system and the cerebral cortex are still immature. Despite being produced before birth, the cortical neurons are poorly connected, and most of the synapses are produced after birth during what is called the exuberant phase, where there is this synaptogenesis that is happening. Okay, so this is happening after a little later on. So the newborn brain now also contains little myelin, and myelination appears to be virtually an automatic or an innate process. And for this automatic or innate process, you need sensory afferent stimuli to these neurons and the neuronal pathways, and which essentially is the neuroplasticity of the central nervous system. But this neuroplasticity of the central nervous system is a two-edged sword. And I think this is the fundamental area from where this conflict starts. You need this neuroplasticity. You need young children's brains, which should be open to learning and enriching influence, so that this automatic or innate process develops. But at the same time, it leaves them vulnerable and susceptible to a bad environmental input. So when you come to the neuronal communication of the brain, you have on one side the excitatory glutamate receptors and the inhibitory GABA receptors. And this is there in the neonate infants, and it is there as it is in the adult anatomy as well. What has been seen is that in the developing central nervous system, GABA receptors can also be excitatory, and this has possibly something to do about how anesthetics can influence the neurodevelopment of the central nervous system, which people are thinking about. You need the neurotransmitters. You need in the developing brain, these neurotransmitters play a central role in brain morphogenesis, in the formation of synapses, the proliferation, the migration of neural networks, the differentiation of the neurons, and the survival of the neurons. So you need these neurotransmitters. And during the very early stages of normal brain development, that is neurogenesis, neurons are produced much in excess. That we do not, the child or the developing child will not need this excessive neurons. And around 50 to 70% of all the neurons or the progenitor cells that are produced are eliminated. So they are lost. And this is critical for normal brain structure and function. In later stages of normal brain development, that is during synaptogenesis, and this is obviously later on, neuronal elimination is very tightly controlled. A small number of neurons are destined to die. These excess cells are eliminated by an inherent program or an inherent cell death program, which is called apoptosis. And this apoptosis is mediated by a caspase enzyme system within the cytosol, which can again be intrinsic and extrinsic. And this is a cartoon about how the programmed cell death or apoptosis happens. You have a normal cell which shrinks because of chromatin condensation. There is membrane bleeding, then the nucleus collapses, and there is continued, and then it becomes the small body formations, which is called the apoptotic body formations, and there is subsequently the lysis of the apoptotic bodies. This is programmed cell death. This is because you have excess and you want to get rid of the excess. Now, let us bring in the topic of interest, that is the anesthetic agents. Are they neurotoxic? Now, general anesthetics, we all know, are highly lipid soluble. They can dissolve in every membrane, they can penetrate into organelles and interact with numerous cellular constituents. This is typically because of their lipid solubility. They have the possibility and the potential to affect gene expression and therefore protein synthesis and processing and therefore cellular function. How? It is still poorly understood. Plausible biochemical substrates for durable long-term effects in a number of tissues have been thought about. We still do not know how it happens. How did they affect? Now, this is coming to the core issue about how is it thought of that these anesthetic agents can be neurotoxics. Now, one of the things that people have thought about is this neurotoxicity is by increased apoptosis, or you are causing programmed cell death in the central nervous system. The other mechanism is it's not just apoptosis, or it could be apoptosis, plus it could be receptor mediated blocking of NMDA receptors or stimulation of the GABA receptor. So it is also could be receptor mediated. Now, apoptosis, how it is? Now, we thought that apoptosis could be intrinsic, extrinsic. This happens to the intrinsic pathway, and which is the mitochondrial dependent pathway. The anesthetic drugs causes an increase in the mitochondrial membrane permeability and therefore can release cytochrome C into the cytosol, and therefore there is a recruitment of the caspase system, and moment the caspase system is recruited, it leads to, as we thought, it is mediated by caspase, so it leads to apoptosis. And this is a cartoon again how it happens. So it can go in through receptors or go in through just the lipid permeability, goes into the mitochondria, releases cytochrome C, the caspase system is activated, and it leads to the programmed, as you can see on the top bottom left corner, the commitment to cell death. So that is about how it can. Now, okay, let us accept that it is bad. When is it bad? So what is this susceptible period? The preclinical, and this is what we talk about about preclinical, is essentially non-human studies. So preclinical studies strongly suggest a narrow window of susceptibility to this anesthesia-induced neurodegeneration. In the developing animal brain, is particularly vulnerable to neuronal cell death after anesthetic exposure. In rodents, up to 7 days of age, and in rhesus monkeys before 5 days of age. And the vulnerability quickly diminishes with increasing age. What about human vulnerability? Estimates for the equivalent time period in humans have ranged from the 3rd trimester of gestation to 3 years of age. So therefore, neonates, infants, and toddlers are vulnerable to anesthesia-induced neurotoxicity.